go to the ER. And we go to the ER, and a neurologist checks me out, and he does the little finger test, and I say, "Yes, I'm seeing 4 of those over there." And they still send me home, right? And this is unbelievable because every single one of these symptoms are, like, very, very clear that they are brain related, but I'm just getting misdiagnosed left, right, and center.
Hi, today on the Headcast, I'm joined by the brilliant Mimi Hayes, comedian, author, filmmaker, and brain injury survivor. Mimi, thank you for joining us. It's great
Thanks so
to
much
see
for
you.
having me. Yeah.
Now it looks like the sun's shining there.
Yeah,
Oh,
it's
glorious.
10 o'clock. It's 10 a.m. Mountain Standard Time.
That always sounds really exciting. People will explain like Mountain Standard Time. You know, the UK, we think we're big, but we're this tiny little island, aren't we? So the idea that you've got multiple time zones always sort of blows my mind a little bit. And today is the first day of the year it's not rained for us here. I'm sure there's other parts of
Yeah.
the country that hasn't rained, but it's rained every day, so it's fantastic. We've had a little bit of sun today.
Well, that's great. We are encountering a drought.
Wow.
Colorado is known for snow, and we have not gotten any of it. So
Wowzers.
it's a bit odd. It's probably 50 degrees Fahrenheit out here. It doesn't feel like winter, so
No.
it's a little concerning.
Are you missing the snow?
I mean, I prefer warmer climates, but I'm just concerned for the climate and that this is
Absolutely. It's
not
not.
normal.
No, it's not, is it?
Yeah.
And you're a lot younger than me, but we have to be careful as we get older with the rose tinted specs. I don't know if that analogy translates if you use
Yes.
that term in the States. I remember that it always snowed every winter as a kid, but according to records, it didn't. When I look back, but my memories are every winter there was snow and I could go out and play in the snow with my friends and my dog. But when I've looked it up and Googled, there's like a decade of no snow where I used to live, but that isn't the
Really?
memory I have, yeah.
Yeah, well, memories can be deceiving, right?
Absolutely.
I swear I know where I was 11. I was a kid, but I remember where I was, but my mom's story is quite different. So it's interesting.
Yeah, no, I can remember where I was, like it was yesterday. I can't remember other world events as I can as clearly as that,
Hmm.
which isn't surprising, really. It's unbelievable. Mimi, I wanted to take you back, if you don't mind, and just share with listeners and viewers just really your story when it all changed for you in terms of brain injury, if you don't mind.
Yeah, I do not mind. That is why I'm here.
Thank you very much. It's very kind of you.
You're so nice. You're like, is this okay? I'm like, yes, this is okay.
I know, but it can be exhausting, and I don't want to keep taking bits of your soul away by asking the
Oh
story.
no. No, it gives me purpose. Yeah, so it was 2014. This was 12 years ago now. I was 22 years old and I was living in Denver, Colorado, and I was fresh out of college on my way to becoming a high school history teacher. And part of what we have to do here in the States is do student teaching. So it's about a semester, a term, 6 months as an unpaid teacher teaching under the guidance of another teacher. So I had that all set up in Denver, and I loved my school. I loved the teacher I was working with. I was going to a lot of teacher trainings through the university to get me ready for my teaching semester. So I was quite busy. I was also newly single for the first time in like 5 years. And so I was this was back when dating apps had just started and they weren't, it was a wild west. It was still interesting.
I can't
But
comment on dating apps because of my age, and if I do comment on them, when my wife listens to this, she's only going to be asked, why am I commenting on dating apps when they weren't around when I was young?
yes, so I was very busy. I was going on dates and I was meeting people and all leading up to my student teaching. And I went on a date one night about 5 days into my teaching semester. So I had just met the kids. I was kind of going through the syllabus, getting to know the kids. Oh my gosh, what am I getting myself into? I have no idea what I'm doing, lots of nervous energy. And I go on this date to kind of distract myself, I suppose. And I have this really bad migraine and I'm just kind of pushing through it. I'm just deciding this guy's kind of boring and that I don't think he's going to get a second date, that I'm here having dinner.
I was going to say, it's a bit
We're,
early in the date to be saying you've got a headache, isn't it?
yeah.
Meant to come a bit later.
Yes. So it just was building kind of throughout the day, and this ended up being about a 24-hour migraine. And I leave the date, we part ways forever, and I go home and I'm just really really uncomfortable, really in pain. I've never had a migraine really before. I maybe had headaches, but nothing like this. And then I go about my life as usual, and I go to work, and I am with the kids, and I'm balancing this busy schedule. And all the while, I'm having all these kind of weird symptoms.
I thought it was yours. It's my dog's.
I was like, uh-oh.
Yeah. But if it, well, I'll try and turn that bit down. You carry on.
Okay,
Sorry.
perfect. No, no worries. I just wasn't sure if I needed to stop. So all the while during this time, I'm having these symptoms and they're coming up as really strange symptoms. I'm feeling really dizzy. I'm feeling like I'm not myself, like I can't control where my limbs are, super clumsy. Had this like double vision thing starting to happen. I would take a kid's paper and try to read their homework assignment and I have to close an eye because I couldn't quite see what was on the page. So this is all happening. I'm super tired, I'm very fatigued. I go and see my doctor for a different reason, which I had booked months prior. And I go into the doctor and I'm kind of like, yeah, I know I came here for a different reason, but I'm actually like not feeling very good. And she just wrote me off really quickly. And she's like, you're pretty young. She asked me if I'd been through a breakup. And I was like, yeah. And she was like, that's it. You just must be sad. You're just on the
Hysterical
sad
woman.
train. What's that?
Hysterical. Hyster-
Oh, yeah, hysterical, right? You're just
Crikey.
sad. You just got a case of the sads. So I leave that appointment. This symptoms continue. I go to urgent care. We have kind of this next level up before the ER, which is urgent care. So I sit there for a couple hours. I finally get in and see them, and they write me off as well, and they're coming up with kind of ideas of what they think it is. I got a lot of different things. I got vertigo, depression, anxiety, ear infection. I think someone said I had an ear infection, maybe. They gave me some Dramamine for motion sickness. So this is all continuing. And there was one day I got really, really sick and I called out of work. And this is a funny story too. So my mom is not a doctor at all. She is a psychologist, but she's not a medical professional. But she was also trying to solve this mystery alongside the actual professionals. And she had heard something about like motion sickness and how to like get rid of it. And there was something to like flipping yourself upside down or like, getting the fluids out of your ears or something. So my parents have this inversion table, which is just this kind of
Mm.
chair that you can flip upside down and you strap yourself to it. And it's really for your back. It's for like body
You don't
alignment.
have to explain to me. What they get up to is their business.
You're like, we got one. So they strap my sister straps me to this thing. My mom's like, okay, go upside down for 30 minutes, see how you feel. I do that and I just feel so awful. I am vomiting my guts out. I can't see straight. I can't move my head. I'm just like out of it. So we go to the ER and we go to the ER and a neurologist checks me out and he does the little finger test and I say, "Yes, I'm seeing 4 of those over there." And they still send me home, right? And this is unbelievable because every single one of these symptoms are like very very clear that they are brain related, right? But I'm just getting misdiagnosed left, right, and center. So we go home again. We call my doctor again. We say, something is seriously off here. We've been to several different, places. Fix this, deal with this. And she again just says, nothing is wrong. You're overreacting. And my mom says, no, we're gonna go back to the ER, and we are not going to leave until we know what's wrong. So there you have it. My mom is just, very intentional about being a mama bear, and she's like, "This is what's gonna happen."
It
So
is
we go
hard as
back.
pain.
Yeah. So we go back to the ER, and my mom says, "We want an MRI," and they're like, "You don't need an MRI." And this lady does the finger test again, except she's doing it wrong because my mom had watched the neurologist do it and he had moved his finger from side to side to get my vision to double. Because if you just put the finger in front of me, it was fine. But it was the movement that got it going. So my mom says, "You're doing that test wrong." And she steps in front of the nurse and she says, "This is how you do it." And she goes like this. And if you watch my eyes, they were like rotating. They were like not tracking well, rotating, and I was seeing double. So finally they're like, okay, I guess we can do an MRI, but you're gonna have to wait. My mom was like, oh, we'll wait. We will wait. So we wait there, we get the MRI. First thing out of this lady's mouth when she walks in the door after the results come back is, your daughter's brain is bleeding, she says to my mom. Because my mom was, leading this whole charge. And she says, your daughter's brain is bleeding. And then she leaves the room. And I don't know where she goes. I think she was actually going to call the neurologist in the hospital. But for all I know, she's just like, it's like a bad date. She's just like, I'll call you later, maybe never, see you later, bye. So she just leaves the room and I'm having a full panic attack. And I'm like, cool, I guess I'm dying on this table today. That's what's going to happen. I have no idea what's coming next. And my dad shows up out of nowhere. It's like he just magically appeared. He flew down the highway at like 100 miles an hour. I don't know how that translates to your metrics, but he was going very fast. We're just sitting there waiting for to meet the neurologist. They finally admit me, and I spend the weekend in the hospital, meet the neurologist. He finally pulls up this brain scan and he says, this right here, this little circle is a brain bleed. It's in your cerebellum, and it's part of this clump of cells called a cavernous angioma. And you may have had this clump of cells your whole life. We don't know. Could have, grown at birth, just kind of an abnormality. So they said, you're stable for now. You can go home and we will closely monitor this brain bleed because it can shrink down and expand and shrink down and expand. So let's see what happens. Right. So I go home, I call my teacher, that I was working with and said, hey, I've had a brain bleed. I need to stop teaching for a while, give the kids my best, kind of thing. And I'm on bed rest for like 4 weeks. And in that time frame, I became completely disabled and I lost 20 pounds of muscle mass. I was atrophying. The left side of my body didn't work. I was seeing double full time. And I couldn't taste. I lost my taste. And when that happens, we called the neurologist again and we were like, I think this is not good. She's not getting better. She's getting worse. I don't know why we didn't call sooner, honestly. I think we just didn't know what we were dealing with. And when we called again, they put us back in for another MRI and it had doubled in size. So they were like, well, now we're going to do brain surgery because now it's in a good place to take it out, whereas before, we don't want to touch it. It's kind of not a good scenario. So we scheduled a brain surgery for 3 days from then. And an interesting part of the story is that the high school where I was supposed to be teaching was across the street from the hospital in Denver. So we get out from this MRI and this meeting, and I'm gonna have brain surgery. And the first thing I want to do before we leave town, I say, "Can we go see the kids? Can we go see my students? It's like fourth period.
That's
The
nice.
ninth graders are in, so let's go see them." And I haven't seen him in a month, and I'm using a cane, and I'm withered away, and I want to go see these high school kids. And so my parents just said yes because they're like, well, we can't say no to you because you're having a brain surgery. So you can have whatever you want. We go in and we see my high school students and they are just scared shitless. Their faces are all just, whoa. And I'm like, hey guys, how's it going? And I sit down and I've got my little cane and this kid, pulled up a chair for me. And this kid in the back just goes, Miss, are you gonna die? And I just didn't know what to I was just like, "Oh, no, no way. I'll be back on Monday, I bet you. It's no problem. It's totally fine. That's ridiculous." When I got home, I totally freaked out and I was like, "Oh, wait, I could die."
Yeah, yeah, they do
That's
ask the questions we don't always ask ourselves, don't they?
Yeah, I was like, "Oh, this whole time I've been kind of not going there and joking about everything." So, jokes are over, right? I have to have brain surgery. It might not go well. We don't know. And so I went in for my brain surgery and it was a smashing success, right? But even then, I came out of brain surgery seeing double and sideways. and they just kind of write that down in their little notepad. Okay, interesting side effect. Double and sideways. That's the vision part of your brain that we touched. Sorry about that. So, I'm in the ICU and my friends are coming by and I'm still joking about everything. And they were going to send me home after that. And, it was only because of my mother that I got intensive rehab. And the physical therapist in the hospital said, "Oh, yeah, she's fine to go home. She's good." And my mom said, "I don't know about that. I'm not sure about this. She can't walk. She can't see. She's still running her mouth. She's still yapping the whole time. There's none of that stopped, right?" But she was like, "I don't think that's what we need to do." And we got a second opinion, and this person said, "Yeah, she could probably go to some intensive rehab. There's a center down here by where you live." So then I got transferred and they sent me in a little ambulance down to this other hospital, which I was not happy to be going to another hospital after, you know, all this hospital time. And we get there and I spent 2 weeks in this rehab center relearning how to walk and see and do kind of basic life skills, baking cookies, working with a recipe. I taught a lesson to some of the folks that were there because I still was going to get back to my teaching. That was the main goal, right? After this brain injury was go be a teacher, which was interrupted by this inconvenient brain bleed. So I'm doing all this rehab and I did some outpatient as well for several months. And I got back to the classroom in just a few months after brain surgery. And it was way too soon. I will say that. I wish I would have taken more time to really. There were so many symptoms I was dealing with and fatigue. And we talked about this the other day on the phone. Like, I'm not just tired. Like, there's no amount of sleep that's going to fix what I'm feeling right now. All the while I'm in the classroom with 16-year-olds who are like testing my patience and not listening to me and, being loud and obnoxious. And it was really hard. It was really, really hard getting back to work. So that's brain injury number 1. There's a lot more details here, but I wanna, like, take a breath so you can, like,
Yeah,
process
thank you.
this and ask follow-up questions.
Yeah, what comes to mind, isn't your mother great?
Mhm.
She sounds fantastic.
Yes.
Have you ever met the doctor again? I
That's a
know they're
great
not
question.
magicians, but the dismissive bit, there's obviously some learning and improvement there for the doctor herself. Was there any recognition of that from the doctor? Actually, I could have looked at this different. You're not just a young person, you're a person.
Yeah, years later, I was doing some audio journalism for
Hmm.
NPR, and I was interviewing some people, and I was trying to see if she would interview with me, and I actually found her on Facebook. And I was like,
Right.
"Hi, I don't know if you remember me, but many years ago, I came in with these symptoms and I ended up having a brain hemorrhage. And I wondered if you would speak to me about this for this radio piece." And it wasn't me trying to like do a gotcha moment or
No.
anything like that. I think I was very respectful about how I was approaching her. But she said she was not interested in doing that and that, brains were not her specialty and that, Dr. Crawford took good care of me and she just kinda, again, was a little dismissive and never said sorry, never said, "I was wrong." So I was just
No.
like, that's all I'm gonna get from her at this point.
The anti-litigious part lights up in them, I guess.
Yeah, oh yeah. I mean, they kinda can't admit wrong or they will get sued, and
Mm.
we were at that point. My parents were documenting everything. Like, we had a spreadsheet with who I'd seen, what they said, the symptoms I was having. They were ready to sue.
Yeah.
And, that was actually something I forgot to say is that in the second ER, when they were kind of not willing to give us an MRI, my mom said, "I will get my attorney on the phone right now." We didn't have an attorney. We didn't have one, but she lied, and she was just like, "If you don't give us what we want, I will take action. I will get that person on the phone." And they were like, "Okay, here's an MRI." So you have to be really aggressive.
Yeah, well, it's a really vulnerable position you're in. You need someone to advocate for you. It's fantastic
Mhm.
that she did.
Mhm.
So it's interesting, really, the doctor's reaction to that. It's quite disappointing.
Yeah, I mean, now that I think about it, like there was so many red flags, and
Mm.
now I know the acronym Be Fast,
Yeah.
balance eyes, facial drooping, arms, speech, and time to call 911. And I had a lot of those. I had the balance in the eyes. My speech was getting a little slurred there with the 4 weeks into the whole business, it was getting there. And then the arms, I couldn't use the left side of my body for a time after we were diagnosed. But pre-diagnosis, balance and eyes, that was a big one that was missed. And so, yeah, it was disappointing for sure.
Mm. So you said that was the first bleed. What
Hmm.
then happened after that, Mimi, if you don't mind?
Oh, I do not mind. Years went by, and we can talk about what happened in between, right? I hope we do, because there's a
Please.
lot that happened in between. Years go by, and I'm living my life. I'm actually in Scotland at this point in time,
Mhm.
living with my then boyfriend, who was a Scottish guy. And I have another one of those 24-hour migraines. Now, this one, I'm starting to think it's caused by the men that I'm with, but I won't go there. I'm just going to say I was with a man, once again, having a migraine. And, we go into accidents and emergencies, A&E, right? And sit there for a while. And they were actually more concerned that I'd taken too much Tylenol. What is that for you
Right.
guys? That's
Yeah,
a different
it's
name.
an analgesic, isn't it? Painkiller.
Hmm.
Yeah, I'm not sure what our equivalent. I think it's probably cocodamol or something we have.
Yeah, it's something I couldn't remember the name of, but they were worried I'd taken too much of that. They were
Mm.
actually more concerned about that than what was happening, and they wouldn't give me a scan. I don't think they really could, because I was American and there was some deal about, like, we can't really service you unless you want to, like, pay us a bunch of money. And then I was like, I don't have any money to pay you. So they were like, why don't you, when you get back home, go see your doctor and go deal with this. So I was living in LA at the time, and I was actually moving out of LA because I had ran out of money and lost a job and was trying to be Miss Hollywood and kind of misjudged my finances and was just, out of time and out of options. So I was leaving LA, but I had to do this CT scan first. And then I was going to come back to Colorado. So in the car, go to my CT scan. I'm like, okay, blah, 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 whatever. Do my CT, which is like 10, 15 minutes, not quite as long as an MRI scan, as I'm sure you know. And I'm in the waiting room, and they come back to me with a wheelchair. And they're like, can you walk? And I was like, oh my God, do you think I can't walk right now? What did you just find in there? And they say, we're going to take you down to the ER. We're gonna take you down to the ER. And they're all stone faced. They're not saying anything to me. I'm like, oh my God, this is happening again. So I check in at the ER, and I'm getting triaged, and I'm texting my best friend, and I'm like, get over here. Something's going on. It's not looking good. But again, they won't tell me anything. Now, something you should know about me is I'm a fainter, and I faint in pretty much every medical circumstance that is possible, including non-medical circumstances. Let's say you were to tell me about a root canal for some reason, I would be like, you need to stop speaking about that because I'm getting lightheaded. And I've always been this way. I was terrible in health class. I was terrible in science class for this reason. But there's just something triggering to me about medical stuff. And my brain goes, we're dying. Even if you are talking about your stuff, I'll go,
Mm.
"Oh, they're dying, I'm dying, it's time to fade now." So they're gonna do a blood draw. This is the first part of triage, and I'm like, "I'm gonna faint. I know this. I'm declaring this, and I know now. I know better than to just let it happen. I need to communicate this to whoever I'm with." So I said, "I would like to lie down because I am going to faint when you draw this blood." Okay. So she's kind of like, this nurse is kind of put out by this, but she goes and finds a bed for me, and I go lie down. And I faint as predicted. When I come to, there's a bunch of nurses hovering over my head and putting, cold water, cold rags on my face, giving me the little cans of juice, the whole thing. And one of them says, "Does she know the results of the scan?" And I'm like, "What?" And they said, "Honey, you've had a brain bleed." And I'm like, "Are you sure?" Like, I'm so freaked out at this point. I'm like, "Are you sure? There was one in there before, and are you sure that's what you're seeing?" And I just start weeping, and they're like, "Oh God, this lady." And so I'm back in the ER. My friend shows up. I have several more scans, and they still haven't really told me the extent of the bleed. Where is it? What is it? Is it the same thing I had last time? Can I talk to a neurologist? Like, anybody? And they're just kind of forgetting me. I don't know if this is how it is over there, but it's very humbling. You go to the ER and they put
It's
you
it.
in a little room and they forget about you for hours on end. And you keep using your little call button, and a new nurse comes in that you've never seen before, and you're like, "Who are you? And can I get out of here? Can you tell me something? Can I go to blah blah blah?" And the information passes down from different nurse to different nurse. They forget you in this little room. So I finally get admitted to a room in the hospital to stay overnight, and this continues. I haven't spoken to a neurologist. In my experience, that's very important because this is what happened last time. I needed to speak to a neurologist who could look at my scan and talk to me and tell me what's up. So finally, they're like, "Oh, the neurologist is going to call you. She's going to call you. Whoever's on call is going to call you." And I wait there for a day and a half. And finally, I get this phone call, and it's about a 5-minute phone call. And she says, "You've had a brain bleed." And I'm like, "What side?" And she could barely tell me which side it was on. Like, she didn't actually look at the scans. And it was very frustrating. I remember being so frustrated. And I'm like, I got to go home. I got to get back to Colorado
I
and I
can
got to
feel my
figure
blood
this out.
boiling just listening to you.
Yeah. So I'm discharged, and I pack up the rest of my apartment in my car, and my friend comes to sublease my spot in my apartment, and my brother comes to drive me from California to Colorado.
And for people who don't know, that's not exactly just down the road, is it?
No, no, it's about a 16, 17-hour drive.
It's a couple of days. Wow.
So we're on the road, and I'm like, well, at least I'm going back home. And what was super lucky for me was that my brain surgeon from 8, 9 years prior, he had actually left Colorado for some time, as did I. I was living elsewhere. I was living in New York and LA and Scotland and all these places. And there was a time when he had left and he was not in Colorado. And at this point in time, he'd actually come back to Colorado to be at the same hospital where he was before. So it just so happened he was available, and we called him up and we got the appointment. And I was like, "I got to see you again because you're the only person I really trust, right? You've been in there, you know what's the deal. You are the one who's going to tell me what's up." So we finally get the appointment. My mom and dad tag along because I'm like nervous and I won't catch every bit of information. And I actually recorded the appointment. I asked him if that was okay, and he said yes. So I had my little phone popped up, and he says, "Here's your scan, and we're kind of back to square one. Same thing happened in the same place, and we can't be sure why. When we took the first one out, it's not like we felt like we left anything behind, but a new one may have grown, or there was something left, and it manifested. We're back to square one, essentially." Um, he says the word benign, which is not a bad word. It's a fine word, but he said the word benign. And as you know, I'm a fainter. And so I heard the word benign and I freaked out and I fainted in front of my neurologist. And I started handing my stuff to my mom,
Yeah, he
and I
says the
just
word benign, but
interrupted him.
your brain changes that to cancer.
Yes,
Yeah.
yes, I heard cancer, and I was like, "Great, I've got cancer now." And I fainted in front of him, and I laid back down. He propped my little feet up, and we got the whole thing on camera. And I ended up posting it on social media as a joke, only for it to go viral. And I got millions of views on this video of fainting in front of my neurologist. And the internet went crazy. They're just like, "Me too. This happens to me too." Like, "Oh my God, are you okay?" And, all this stuff. So I had my little 15 minutes of fame, with this little video. But yeah, I kind of had to reconfront a lot of this stuff from the first time that I chose not to process because it was too hard to think about my death as a young person and the possibility of not being around, and what that meant. And so it was super hard the second time, the first few months of the bleed. I had a lot of the same symptoms happen. I lost my taste again. I had follow up appointments. I had MRIs, every couple of weeks. I was really on top of it this time. And then kind of all of a sudden it kind of stopped moving, stopped growing. So they said, "You're okay to have your next MRI in 6 months and then a year. We can space them out a bit more unless you have more symptoms, in which case, tell us right away." But it's stopped for now. It's chilling, and it's been chilling since then. And that was 3 years ago. So we're sitting on number 2, just trying not to forget about it, you know?
Well, it's fabulous that, it hasn't caused any more problem for you.
Yeah, we'll see.
I'm, uh, I'm really upset about how you were treated in Scotland. You know, time's a brain, as they say, and emergency
Mhm.
patient. I know it's NHS Scotland, different to NHS England, but I think it's the same principle. Emergency care, regardless of where you're from, we treat. So that's disappointing. You got that. I can't really apologise for them, but I'm sorry that was your experience at such a great country as well, Scotland. So that's disappointing.
Mhm.
Your comedy side of things, does that help? You clearly, when you said the fainting bit, I'm thinking, well, you're a feeling person. You obviously feel all the
Mhm.
feels, and does the comedy
Yes.
help you manage that?
Yeah, it really does. And that was something that we can backtrack in the story as well, because I started doing comedy right after the first bleed. And as I got back to teaching, I started writing these stand-up bits, and I started going to open mics. And I didn't really know why I was doing this because I'd never done stand-up before. I had done improv, which is a bit different because you don't
Mhm.
write it out, you just go on stage and play and have fun. But I just kind of started getting on stage and exploring this crazy story and all these people I'd met in the hospital and all the weird symptoms and side effects and trying to date again after, this happened to me on a date, and it's a bit traumatizing to go on a date again and be like, am I okay, right? So I start doing stand up and I start writing a book, and I continue writing the book all throughout the experience, kind of capturing it super raw, super like as it was happening to me, and kind of documenting all these feelings. And when I quit teaching 2 years out, I lasted 2 years. I decided, I actually want to do this comedy thing and I want to do this writing thing. And teaching stuff's not really working out. Like I'm kind of over it at this point. And I had this whole manuscript completed and I had all these stand up things. And I was like, you know what? I'm gonna move to New York City and I'm gonna do stand up as much as I can. And I'm gonna try to get this book published and into the world. And that is exactly what I did. And I will say, I don't think the stand up was particularly funny at first because it's a very raw topic that a lot of people don't like to be confronted with
Mhm.
death. And so, I had to work with that, and I had to be like, "Okay, how can I make this funny? How can I make this relatable? How can I not scare people?" Because sometimes people will come up to me after the show and be like, "Did that really happen? Are you okay?" And I'm like, "Yeah, I'm okay." So I had to really, like, work with how it was gonna be funny and this kinda dark humor that I was working with. So I continued doing that. I wrote the book. I published the book. I was doing stand-up with some great comedians on some great stages, opening for a lot of people I admired, growing up. And then the pandemic happened, and we all know what happened then. We don't
Mhm.
need to go into that, but I had to come back to Colorado at that point, continuing my writing, continuing all my different things, but it was pretty hard on my comedy career. And getting booked for a time. And then I went to LA and I was like, let's do LA, let's do Hollywood, let's do screenwriting. And I had written a TV pilot that was closely following the book and telling this story of this young, you know, teacher who wants to be this amazing teacher who life flips upside down and she has a brain hemorrhage. And so it's very tied to my life and my story, but there's also some artistic license that happens and some
Yeah.
things I skew a little bit to make it a bit more drama and TV, fun. I had moved to LA with the hope of making that project, and it was just a bad time in LA. It was still early kind of pandemic times. Bunch of shutdowns were happening, strikes were happening, writer strikes were happening. So that didn't manifest at that time. And then my head exploded again. So, there's been a lot of
Mhm.
stops and starts with my comedy. Luckily, I have also found public speaking to be incredibly lucrative for
Good.
me because I go to these conferences, these brain injury conferences, and they have me as a keynote, but it's like a comedy show. And people are like so surprised that I'm like up there doing my comedy when most of the other speakers are like doctors and clinicians and they're a bit dry. And here I come with my jokes and my ha-has and, it's been really fun to have that kind of impact and to blur the lines between, like, storytelling and comedy and drama and near death and make it funny for people, and I have found a lot of purpose in that.
That's fantastic. And it will freshen up the conferences as well. 'Cause as you
Mm,
say, they
yeah.
can be a bit stale, and I've certainly done a fair bit of speaking, but I can't say I'm funny.
Well, you've made me laugh a few times, so that's something.
Yeah, well, I feel under pressure because of what you do. Added pressure. I do
Mhm,
like sharing stories about what happened to me with people, because it and being humorous does allow them a way in, I find
mhm,
as well, and a way of sharing it. But,
mhm.
I'm always worried, and I guess that's your skill, not mine, in trying to find that balance between frightening the horses and not appearing that I don't know what the
Mhm.
vernacular is there, taking the piss out the wrong thing and insulting people, I guess is the way I'd
Yeah,
describe it.
and don't get me wrong, not everyone likes me. I did a TED Talk in 2021 about this whole thing that I had, punchlines inside of the TED Talk, but people didn't like it. People,
Oh,
I would say as a whole, the comment section is quite horrifying. And I think I just maybe struck a nerve because I was kind of saying, like, in the TED Talk, that you can make jokes about your trauma, but it doesn't take away the trauma.
no,
And you still have to face it. And if that means going to therapy or finding a community or doing work on yourself, you have to do that. And I don't think some people got really upset about that. And they're like, what does she know? She's not funny. And I'm like, it's fine. Like, you don't have to go to therapy. You can be awful as a person. Just stay out of my comment section, will you? Like, just let me live.
yeah, people are cruel on the comments.
I get used to it. You have to. You have to have a thicker skin when you do comedy. You have to be ready for someone to just boo at you, and
Yeah.
I do think I got a lot of experience from being a teacher because I had kids, pretty much booing me during the day, yelling at me, saying boo, I don't want to learn and
So do you
not
miss the
laughing at the
teaching?
jokes. Sometimes in weird ways, that predictability, schedule, that knowing what I'm doing every day, except no, I didn't. That's a lie. I didn't know what I was doing every day. I don't miss it too much. I think I miss maybe that former version of myself that would
Yeah.
had this like kind of goal in mind, and I did love working with kids. But at the end of the day, it was so much chaos and just too hard. And I've already done hard things, I don't wanna do more hard things just because. But I do a lot of teaching now still, just in different formats. I teach little kids theater programs. I do it for an hour and a half after school, it's not
Wow.
all day, and, it's cute because they put on little costumes and do their little play, and they're younger, they're not like the high school kids, so they're a bit younger, and they still kinda listen to you and sit next to you and wanna hold your hand, and that's kinda cute. And then I have a coaching business, and I teach that way, and I help people who wanna write books and, a lot of brain injured folks too who wanna write memoirs, and I still do a lot of teaching. That's really all that I do is teach, but it's just so much different when I'm not in the classroom full time anymore.
I wish I'd known you when I was writing my own.
You wrote a book too?
Yeah, it was a little bit around self-therapy, and there was some things I don't mind talking about 'em, but I hadn't dealt with from childhood, which I couldn't get my head around, but I was nearly 50 at the time, and I hadn't dealt with these issues from being a child. That I wasn't sure how to deal with them, so I thought writing them down and just being authentic about it. And I felt there was some interesting things for people that people might find interesting. I've been exposed to lots of different things, I guess, in those 50 years, and I thought actually it might be of value to somebody. But the stroke part was hard. I must have sat there for months just crying onto a piece of paper or onto my
Mhm.
computer because I ended up I did either did it on my phone or I did it on my computer with a dictation software. I didn't have defined control in my hands still at that point.
Mhm.
So yeah, it was a real challenge, but it has helped me. Hasn't helped
It's
me in
very
terms.
cathartic. Yeah, it's extremely
It is.
cathartic.
I'd recommend it. I'd recommend it to people. I felt very uncomfortable in terms of making any money out of it. I got my head around that once some money came in, but I I I felt like I had a bit of a responsibility in terms of how I tell the story, and I don't know if you ever feel that. just in terms of that bit that you're leaving with people. I said before, we don't wanna scare the horses, but at the same time, there's a bit of realism. And you talking about the doctor, I generally like to think, 'cause I have a lot of medics who listen
Mhm.
just because of former career and people which I know, and I'd like to think that they pick up on these things and how they might approach it themselves in the future. So hopefully people listening to your story also pick up on that actually, that approach. I do think it's awful,
Mhm.
but dismissed
Yeah,
like that.
and I felt extremely useful this past week because an acquaintance of mine just had a brain surgery. And she was kind of aloof about it. She kind of dropped it into social media like, I got a brain tumor and having surgery. And I was like, whoa, hello, I need to talk to you. And so I sent her fiance a bunch of text messages as she was in the hospital doing the surgery. And I did say to them, don't let her leave the hospital. Take her to rehab.
Yeah,
They're gonna
absolutely.
they're gonna say that she needs to go home and you need to push for rehab. And exactly that happened. They told her she didn't need rehab and they sent her home. And I was so upset about this, but I went to go see her actually this weekend and I brought her my book and I brought her a little care package and this whole printed out document I'd actually made years prior of resources and advice and here's what you might want to consider. And I just told her, I was like, I'm sorry if this is a lot of information, if this is intense, but I just really want the best for you because I didn't have anybody doing that. I mean, I had my mom and she saved my life, but we didn't know what we were up against.
Mm.
And now we do, and we know. And so I want you to know. And so I gave her the phone number to the rehab center. I said, see if you can get in there, call Vicky, call her up, tell her I sent you. So I think she is looking at doing that because, they just sent her home. And I'm like, this is unacceptable, but they don't want to pay for that. That's the truth of it, is they don't want to pay for you to go to rehab,
No, it's the same the
you
world
know?
over, unfortunately.
So they don't want to pay for scans and they don't want to pay for rehab.
How's it portrayed in the media there? Sort of brain injuries and strokes, I'm thinking of drama. Does it feature there?
You mean like in
Yeah,
culturally?
yeah,
Yeah, I would say, like, there's still this stigma that strokes happen to older folks, and you'll
which is a
see that
loaded
in.
question.
Yeah. Yeah, I mean, you'll see it,
I'm dead
like.
touchy about it. And there's 2 programs which I think of, and the programs which I really like, which I don't know if I'm being too touchy, but I can see people in the room with me if they're watching the program and looking at me. How do you feel about that? So one's The Big Bang Theory. So yes, I know it finished a long time ago, and the other's another American drama which I really like.
Mm,
It's one about community college, but it seems to be every other episode. If someone's acting differently, the joke is, "Oh, what, you having a stroke?" And the first time I hear it, it's funny, but it's actually every episode.
is it really?
It's not the odd comment, and I can't help thinking a writer there really thinks this is funny.
Mm,
But would they say, "Oh, we don't hear him joking around cancers or your clothes aren't fitting well to somebody. What's that? If you had a mastectomy and you've not got it." There's none of those jokes made. So yeah, I am a little
mhm.
bit touchy about it. Maybe I shouldn't be. I shouldn't be so oversensitive, but it then gives that wrong
No,
portrayal.
I
Because you're
get
right,
that too.
there is that age, that it's an older person. And luckily, America's a much bigger country, and we have similar issues certainly around obesity and drugs and alcohol, and diabetes and things we know are causing strokes. Luckily, certainly in the UK, strokes are doing sort of that in terms of leveling off, but those of a working age, it's doing that.
Mhm,
There's no conclusive reason as to why it's doing it. It's complex, but there's lots of theories around it, including air pollution at the moment.
mhm. Yeah, and they were talking about, this wasn't my case, but I know some people who it was the case for was that birth control pills caused
They do.
the
I've met
stroke.
some people who've had a stroke from birth control pills.
Mhm,
I know they're fairly
mhm,
strong in terms of checking people's blood pressure, but it's a surprise to people when they find out it can. I always wonder, what's the conversation? Clearly, I've never been prescribed them, but I do wonder what the conversation is that takes place, with people to let them know. Whether it's a case of, well, they'll
mhm,
read that slip of paper nobody reads inside the medication.
mhm.
I don't know. Is there something which you would, after all your experience, is a misconception? No, not just the age thing. Is there something which actually you wish? I'm thinking of the medics and the clinicians now knew that they don't know, about your experience.
Yeah. I would say, I am super high functioning and I got so much functionality out from doing rehab, you
Mhm.
know, but I'm still fighting for my life.
Yeah.
And I'm wearing my noise canceling headphones. I don't know where I'd be without these. It's much easier here in Colorado, but when I was living in New York City and LA in some places, I couldn't go anywhere without these because the world is too loud for me. It's too bright for me sometimes. It's too chaotic. It's too noisy. There's too much going on. Me in crowds, no. You won't catch me in a place that's crowded really anymore because I panic and my movement changes. If I'm forced to walk slower, like even at a museum, I struggle at museums because people are walking super slowly,
Yeah.
to look at the paintings and such. And I just, my movement gets off and I need to go and I need to escape.
Yeah, you get a particular cadence going, don't you? And you've got to stay in that motion.
So, I'm struggling. I struggle. I can't work full time. I am on disability. Here's a fun story. I'm about to get kicked off of disability because I'm making too much money. And the American Social Security system does not want me as a disabled person to make money or be successful. So, it's very frustrating that now I finally got on disability after 2.5 years of fighting. That's something that's a big misconception too, is that if you're on disability, you're a slacker, you're lazy, you're not
Yeah.
working. And I've been fighting. I've been working this whole time, hustling, doing anything I could do to try and make ends meet and get back to some semblance of normal. But the
That's
truth is, I can't work
inspirational what
full
you do.
time. Yeah.
No,
I mean,
and
that's
people
just the
people
truth.
don't get that, but the day before all this happened for you, as you say, you were teaching, and then the day after, that's it, life's just changed. And
Hmm.
you clearly, what I call a grafter. You're doing everything you can to earn an honest
Hmm.
wage, and good on you. And you've been paying your taxes all your life, working.
Yes.
So it's not free money, the social security money.
No, and
It's
it's
been
it's
built upon
not
what
a
you've
lot
put
of
into the
money.
system. No.
Yeah, and that's part of the problem is I had not worked long enough. If you become disabled in your 60s and 70s, there's a lot more offering
Yeah.
for you. But if you're a young person, you become disabled. They're like, "Here's $5. Is that fine?" And you're like, "No, it's not fine. Like, help me." And so I'm working on getting off of disability now because I'm a public speaker and I can charge a lot of money to do. I've been working at this for a decade. Like people are starting to call me and I
There's a
wanna
value
do
to it.
this.
Should think
Yeah,
so.
there's a huge value to it, and if I can keep doing this and I could do more speaking gigs, then I won't need financially to be on Social Security, but it's a huge misconception, and
Mm.
I understand now why so many of my brain injured and disabled friends are not on disability because it's just not worth it
No,
to keep you in poverty.
it's a real contentious subject in this country at the moment because our bill for disability has gone through the roof.
Mm,
Certainly since COVID, but there's almost an anti feeling out there I pick up about people who claim disability benefits in this country as though they're sponges, and I may have said to you when we spoke the other day, I don't really believe in these hidden disabilities. I just don't think people have actually took the time to find out or to, you've explained some things already about yourself, and I think people make some poor assumptions about people.
mhm,
Because you're disabled, you can't do X, Y, and Z. So I can't walk very far, but I've said it a number of times on the podcast. But I can ride miles. I fall off every time, but
mhm,
it's not balance. I can't tell my foot to get down sometimes. So it is quite funny. I can be sat at a junction and I know I've got to put a foot down, otherwise I'm going to topple off. So I'm thinking, put your foot down. It's not going
mhm,
anywhere. My
mhm,
arm will move instead of my foot, and over I go. So I'm really good at falling off. I've sort of got it
mhm,
down to an art where I'm not breaking something. But when I do my disability claim and they ask, well, what's your mobility like? Well, it's not good. I can't walk. Well, can you get out? Can you cycle? Yeah. Oh, so you can actually get around places. Well, I can on my bike, but our roads are crap. They're full of potholes. I end up
mhm,
not being able to keep my line and falling off. This is really difficult, but you can do it. Yeah, I can do it. And I can see, no, there's a way of paying him less. And
mhm.
it's frustrating. It's just those prejudices that I really believe people have still got against people.
Mhm. Yeah, yeah. And I have found, like, more of my viral videos come from me talking about my disability and people calling me a liar
Yeah, people enjoy doing that, I've
because
noticed on people.
because I can walk and I can talk and I can. be on an airplane and go do a comedy show." And they're like, "Well, that's clearly you're a liar." So I get a lot of those comments too, and people can't conceptualize if there's no wheelchair, then what
No.
disability are you speaking
Well,
of?
I know
And there's just so
you'll
much
be
more to it.
masking, and if you're tired now, you're not showing it. You know, we push through things, you know, and through the pain because you've still got to, as you say, keep a roof over your head. So if you had the choice, you wouldn't be doing some of those things, but sometimes there isn't a choice, and you just got to get out and do it. The last thing I wanna do now is after this is to go and walk my dog, but there's no way I'm not walking my dog. So I'll go out and do it, and I'm sure there's plenty of people in my position who wouldn't and say it's too painful, but it keeps up here as well working better, I think.
Mhm.
You've got to keep out. So I can't finish without asking about the dating situation because it is hilarious. I'm really sorry to say so. So
Mhm.
is that a genuine angst for you?
You know, not really. I mean, it was funny the first couple of years trying to go on date. It was a real concern, I would say,
Yeah,
immediately after the brain surgery because I didn't know, is it if it was going to happen again. I was super anxious, and I would tell guys I was seeing, please be gentle with me, like I don't know if this is going to happen again or if I'm just going to need more patience from you or what have you. But I think the most frustrating thing for me now is just the telling of the story and who gets to hear it and who has earned it. Because I think I've given my vulnerability and my awesome story to some guys who just didn't even deserve it.
no, I was just about to say that if they're not going to give you the patience, fuck them. They're not worthy of it.
Well, and even just kinda being aloof about it, and I'm like, "This is the biggest story of my life, and, like,
Yeah,
you need to know it." Or I've also had experiences where guys Google me before we go on dates, and that's not good because then they think they
I'm
know
really
everything
glad I'm
about
older.
me.
I'd be useless dating in an age with Google and things. The idea that someone's
Yeah.
Googled me beforehand. It's not crossed
Yeah,
my
I
mind
mean
that people would do that, but now you say it, I see employers do it all the
yeah.
time now, don't they?
Yeah, but I would say the main thing is just, I've been through so much in my life that if I'm single right now. If I'm gonna be in a relationship again, it needs to be someone absolutely amazing who can really contend with what I've been through and treat me better than I treat myself. And I treat myself very well these days. So that's the biggest thing. I learned a lot of self-love through the brain injury because I also, was newly heartbroken at the first time around. And then the second time it happened to me, I also had another bad breakup. So these things kind of go together. My head explodes and my heart explodes. And I'm kind of like, okay, let's reset. But yeah, it's not easy.
So
I'm not super
I've never been
impressed.
on a dating app, but I heard the other day that people are putting some of the dating apps allow you to put your political persuasion as it's again, isn't it doesn't matter where in the world you are, it's always a hot
Hmm.
topic, isn't it? And some
Hmm.
people just their ideology, they don't want to be with someone who follows a different ideology. And I can't help thinking, actually, I wonder how it would go down if there was a disability box. Do people automatically think, oh, we're going to be in a, I'm not saying it's the worst type of disability to be in a wheelchair, as having been there and not there now, you know, we know there's different types, but again, it would challenge perceptions. But maybe there's a business opportunity for a dating app for people.
Exactly.
And maybe there is,
And
and I just don't know about it.
yeah, you know what? There might be. I'm not confident about that, but at
I
least
might
within
Google it, then
friends,
get rid of my search history quickly.
delete browser history.
Yeah.
Yeah.
I I've got to, I always wonder about things like that. I'm going to have to say it because I do like to go off topic. Is you know, people who are arrested, you know, maybe a terrorist or a criminal, and they say they looked at their browsing history, and 10 hours before they were looking how to kill X, Y, and Z people. And I'm thinking, does nobody know how to clear their browsing history? And would you have Googled that before? You know, it can't be that serious. You've got
Mm.
to Google how to do some things. So I Google some things thinking if I die today, I'm wondering what people find on my browsing history. There's nothing I'm particularly worried about, but I'll type things just to say, well, this is what he was looking at beforehand. So it's a strange way I think, I know, but
No, it's actually one of my jokes. I tell on stage and I say, it's in the room with the first MRI, and when she says, "Your brain's bleeding," or "Your daughter's brain's bleeding," and I say in the joke, I say, "I don't know if I'm gonna die in 5 days or 5 minutes, but I
yeah,
did not clear my browser history." And
no,
it gets laughs, and it's like, I also don't have anything that embarrassing, maybe, like, weird celebrities. I'm like, "Where did they grow up?" And, like, I'm looking into weird
thank
things
God I'm
and
not the only one who does that.
no, you are not at all.
I, uh, I can It's not funny, but I can remember being on the table, taken into A&E and them telling me it was a headache, and I can remember turning to my wife and saying, "It's not a fucking headache. I can't move my." So I now know migraines can cause serious, problems, and I guess I've educated myself a little bit on that now, but I can remember at the time reacting quite badly to that. And
Mhm.
there's a joke amongst cyclists that one day, your wife or your partner will sell your bikes for what you said they were worth. And genuinely, I was in the hospital in my bed, and I knew I probably wouldn't ride my bikes again. I'm speaking to my wife by text, and I'm saying, "Look, I think I'm going to sell some of my bikes when I come out because cyclists, the formula for how many bikes you need is however many bikes you've got plus one. There's never enough. It's quite
Mhm.
sad." And I said, "I'm going to sell that bike," and she says, "Okay." I said, "Can you help me list it?" And she said, "Yeah. How much do you need to list it for?" I said, "Oh, about £4,000." And she's like, "For a bike? You spent where did you get £4,000 from?" Well, it just needs and I thought, crikey, if I do die, she's going to sell these for what I said they are worth.
Uh-huh.
That isn't what I really paid for them. So I realised I shouldn't be lying to my wife. So yeah, got to be careful.
Yeah, that's funny. Yeah.
But yeah,
I will say this, so I was a competitive ice hockey player in my
wow.
childhood
Yeah,
into college, and I quit before the brain injury because I was just burnt out as an athlete, so I quit. The a couple was it a month? No, okay, it was a couple of months after brain surgery. There was a family skate because my dad also plays and my siblings both played, and we're all goalies, if you can imagine that. I'm like 5'2". I'm too tiny to be really a good goalie, but I'm still out there in my gear, and we get out there for the family skate, and I didn't know how to do anything. My whole body was like all the muscle memory was completely wiped from the brain surgery. And so then I finished that skate. I got off the ice and I was like, that was really hard. And I'm officially done with hockey now. 10 years, 12 years passed by. I started playing again 2 years
wow.
ago.
You got to be mad to play ice hockey.
Yeah, and they actually put me in the competitive league, and I was like, "Okay, here we go." And I actually have gotten back to a place where I feel like I'm almost where I was. Not quite, I never really will be at that level again in my life, but
I'd started going to watch with my youngest daughter a couple of years ago, and we really started to enjoy it, mainly because it was a legal fight you could just watch. Now, I didn't realise it was really like that. And this will
mhm.
make you sick. I turned down Stanley Cup tickets when I was in Canada. I know, but it was ice hockey, and I was over there with my best mate visiting what became my first wife in Vancouver. And someone said, "We've got tickets for an ice hockey game." And I remember us looking at each other, bloody ice hockey. What's that? Because it just isn't a sport that's really played here much. And then
Huh.
years later, I look back, and I think it was the year there was riots after it as well, after in Vancouver.
Okay.
So we are probably
Yeah,
going back,
wow.
what, 25, 30 years ago.
Yeah, okay.
So I can't believe I didn't go.
That's funny.
But
That's funny.
it is an incredible sport. And it's been good
Yeah.
watching it during the Winter Olympics. I don't know if you've caught. Well, you've been successful, haven't you? America's.
Yes, women and men both won gold. Yeah, that's why I started playing was because I saw the Winter Olympics in 2002,
Hmm.
and I was a kid, and a bunch of girls wanted to play hockey when we saw the women win the gold medal. So there was a huge, huge bubble of young girls hockey. There was a whole league. We still have a whole league for women's young girls in the state of Colorado. So it's a good place to play hockey,
Yeah.
but I never thought I'd get back to it. And there are
Well,
times
well
like
done, yeah.
I get a puck to the head and I'm like, listen, you, this is expensive hardware over here, okay? We can't pay for another one of these. So you keep that puck out of my face."
I think hockey players are all like, if it was a band, they'd all be the drummers, wouldn't they? They have
Oh
that
yeah,
sort of
hardcore.
reputation. Yeah, absolutely. And
Hardcore.
certainly if you goalie, where other sports, if you goalie, it's the area where you just take it easy. You can watch everyone else play, but you're literally getting fired at, by
Mhm.
instinct. It could kill you. It's phenomenal. So well done you for getting back to that.
Thank
But
you. Yeah.
it is inspirational listening to your story, and I hope other people find that as well. And you've been really open, so thank you.
Yeah, thank you so much for the interview. It's been really fun to chat about it and hear
Yeah,
a bit about you as well.
yeah. I'm sorry about the dogs in the background.
Well, I've got one here too. I'm just like, you better behave.
No, I gave them a couple of carrots beforehand. It normally shuts them up, but it hasn't this time.
Well, I haven't tried the carrots. Maybe she'll
Yeah,
be into that. That's good.
yeah. They do. They seem to love carrots. hate it when I chop them up. You gotta give them a full carrot, they love it. Go and try it after this, give them a carrot.
I will, I will.
Thank you. Well, nice to meet you. You take care, and I will read your book, I promise.
Thank you. Yeah, I really appreciate it.
Cheers, you take care. Bye, Mimi.
Bye.